AI Healthcare Scribe tool. In this demo, a patient is seeing a thoracic surgeon after an MDT meeting, and the thoracic surgeon is delivering some results to the patient and discussing what the next steps for their treatment will be. As you can see, this tool is able to generate different types of output, such as shorthand notes or clinical letters as listed here. For the purpose of this demo, we'll be demonstrating the output of both types, the shorthand notes and the clinical letter. But please note that the type of output which can be generated is completely customizable to the needs of the clinician.
Good afternoon. Hi. I'm Mr. Smith. It's Mr. Brown, is it?
Yes. Hello.
How do you like to be called?
Robert's fine, thank you.
Robert, good afternoon. Please have a seat. And this is?
This is my mum, whose name is Emily.
Hi.
Right. Hi, Emily. Please have a seat.
Thank you.
So, Robert, you've had several tests over the last few weeks.
Yes.
And my colleague who you saw a couple of weeks ago mentioned to you that we think you may have had lung cancer at the top of your left lung.
Right.
So that has been confirmed subsequently. So I have some good news too. The PET-CT has confirmed that the tumor is limited to the top bit of your left lung.
Okay.
It's fairly early stage. It's stage 1. It's not spread to the lymph glands or to elsewhere in the body. And the biopsy has confirmed that it's a type of lung cancer that can be treated very well.
Okay.
So the plan is, we've discussed this in what we call the multidisciplinary team meeting yesterday, where a group of specialists, such as myself, physicians, etc., sit together and discuss what is the best way to treat a particular type of cancer in any patient. And it was felt that in your case, you would benefit from surgery. And that's why you're here to see me.
Right.
So any thoughts on that, Robert?
Do you think that a surgery is necessary?
That would be the best treatment for this early stage cancer. That would give the best chance of cure. And given that your fitness test has been pretty good, I would expect you to be able to undergo surgery and recover smoothly from it.
And I think just, one thing I'm a bit concerned about, I'm quite an old man. I'm 60 years old now. Will that have a big effect on my
Robert,
outcome?
60 is the new 30 for thoracic surgery. We not infrequently operate on patients who are more than 80 years old. Like I said, your lung function is pretty good. We feel that you will tolerate losing a bit of your lung. The other good news about this is not cutting open your chest. We'll be doing it by making 3 small holes in your chest, putting a telescope in, having a look, and putting instruments through those small holes to do the dissection and removing this bit of the lung. So it is relatively less invasive than what was perhaps done 20 years ago.
Okay. And what would be the risks potentially of this procedure?
So that's a very valid question. Any procedure, there's no procedure that's without risk. Let me explain in detail, a little bit more detail, what the procedure entails. So you'd be looking to come to the hospital a day before the procedure. You'll be in the hospital for about 2 to 3 days, including the day of surgery and a day or 2 afterwards. Like I said, the surgery is usually done by putting a telescope into your chest. There won't usually be a big cut in the chest. It's through 3 small, what we call ports. On rare occasions, we may have to convert this to do a bigger operation. The risk of surgery, the first risk is pain. You may feel some pain after the procedure, but you will be under your own medication control for pain control, and that's very effective in the early days.
Right.
And in the subsequent days, you will be on oral painkillers for the subsequent few days. Any procedure has a small risk of infection. The risk of infection is under 2%.
Okay.
The risk of major surgery, which this is about 1%. That is the risk of dying from the procedure.
Okay.
So a vast majority of the patients recover, do well, and are fully cured of their cancer. So we would expect you to stay in hospital for about 3 days. After the surgery, you come back to the ward into what's called the high dependency unit area. You stay there usually overnight. You will have a tube coming out of your chest. The tube is there for a day or so and comes out the following day.
Right.
And another 24 hours in the hospital, and we'll discharge you, and then you'll come back to a follow-up clinic, usually a nurse-led clinic, in a week to make sure things are going to plan.
Okay.
And then we'll see you in the clinic in about 6 weeks afterwards with all the results, and that would include the full result of the part of lung that we have removed.
Okay.
The other small risk is, whilst doing surgery, there may be injury to big blood vessels, especially as we dissect towards the center of the lung.
Yeah.
And if that were to happen, we may have to convert this into a bigger operation.
Oh dear.
And
Okay.
the bigger operation, the conversion to a bigger operation is about 5%. So 1 in 20 patients, we may end up doing a bigger operation.
Right.
And usually that is adequate to gain control of the bleeding and make sure that you come back to the recovery in a stable condition.
Wow. Okay.
The cut can be more painful, so it might also mean a slightly longer hospital stay.
So, let's say that there's no complications. How long would I expect to be in the hospital after the procedure before I can go home?
So possibly 2 days.
Okay.
Very rarely more than that.
And if there is a complication?
It would depend on the nature of complication. So if you require a big cut on the side of your chest, it could be as long as even 5 days.
Oh, wow. Okay. And I've seen sometimes treatments for cancers could be like radiotherapy or chemotherapy. Is that something I could do instead of a surgical procedure?
So for early cancer, the options are mainly either surgical or radiotherapy for the type of cancer, the type of lung cancer that you have. And by far, surgery is better than radiotherapy.
Okay.
So long as you're fit to undergo surgery, which we think you are.
Okay.
Radiotherapy is offered as the first choice in patients who are unfit or, for their own choice, unwilling to undergo radiotherapy.
Yeah.
Unwilling to undergo surgery. Sorry.
I see. Okay. Mom, did you have any questions?
What about Robert's smoking, doctor?
Oh,
Is
yeah.
it something that he needs to stop?
That is a very good, very relevant question, and that is something I was going to bring up. So usually from the clinic till the date of surgery, there's a wait of about 4 to 6 weeks. That is just where we are in the NHS currently.
Okay.
And I would strongly encourage you to think about, and if possible, give up smoking. Even this short period of giving up smoking will have a beneficial value. So one of the things I will do at the end of the consultation is put you in touch with our smoking cessation advisor. They can take you through the pros and cons, give you some support, some advice on how to do, what to do, how to cope with this. But even this 4 to 6 week period of stopping your smoking will be very beneficial.
Okay, thank you, Mr. Smith. It's a lot to take in, but you have explained it very well.
Yeah.
Completely
So
understand.
Thank you for that.
These last few weeks must have been
It's tough. It's been tough.
It's tough.
I never expected this to happen to Robert.
Yes, of course.
Okay. Well, thank you very much.
Thank you.
Okay, so that was the mock consultation, and now we'll demonstrate the generation of the different types of output documentation that could be generated. And so the idea is that a clinician would be able to easily switch between one type of documentation to another and have multiple different documents open at the same time. But for the purpose of this demonstration, to make things simpler, we'll just go through each type of documentation one at a time, starting with the shorthand notes. As you saw, the time to generate the kind of output was pretty quick. Usually it takes less than 2 minutes, but that does depend on the duration of the consultation. So naturally, as the consultation is longer, the time to generate the output will be slightly longer as well. So to begin with, let's go through the shorthand notes. Now this is just a particular format and particular style that I've chosen to show for this. But again, that would be customizable based on the clinician's needs. For example, what the clinician, in this case, may not need to have things such as family history, drug history, or past medical history. So we could just simply get rid of those or use a template which doesn't include those headings in the first place. Otherwise, we should hopefully see a concise, accurate set of shorthand notes that's been produced. And it's very easy to make modifications, as I've shown, and add things in. So, for example, at the end, we've got some steps about what will happen next. So, this no plan mentioned, we'd probably want to get rid of that. And then if we spot anything else, then we can easily modify those things. And, this shouldn't take more than a couple of seconds to go through and make any edits. Now, the other thing is that the shorthand notes are pretty good in terms of using abbreviations, and this is, again, something that can be customizable for the needs of the clinician. At this point, it would be very easy to simply just copy and paste these notes into the electronic record system or wherever needed. Alternatively, the notes could be saved or discarded if we don't need to store them anywhere. So for now, we'll discard the notes. And now we'll go through the clinic letter and see an example of what that could look like. So it should take, again, a couple of seconds to generate that. And here we see, this is, what I've chosen to do here is anonymize it. So there's no patient, date of birth, etc. That could all be added in, once the letter goes into the record system or otherwise. But again, we should see that this letter format has a quick summary of relevant medical history, current medications, and then goes on to format a letter as a clinician may need, and this is something that can be tailored to their style, to their structure, etc. Once again, it's very easy to modify the notes as necessary, although the idea is that there shouldn't be too many modifications necessary. And once again, this can be copied and pasted wherever it needs to go. Moving forwards down the line, things like EHR integration is definitely features which will be integrated and developed. For now, the simplest thing to do would simply just be to copy paste wherever the letter needs to go. So the final thing to mention is that in terms of patient confidentiality and the flow of patient data, none of the consultation data is stored on a permanent basis in the cloud or on the local device. So that includes the audio file and the transcript and the generated summary. So the audio and transcript are stored temporarily on the local device for the purpose of generating this final summary. Once the summaries have been generated, all the other information and data is permanently deleted. And furthermore, even this summary, unless it needs to be saved locally, once it's been copied and pasted to the relevant place, it can be permanently deleted from the local device. So thank you very much for watching this demo and for answering the questions that follow.